Turning now to Capitol Hill, where Ethan Lindenberger is testifying before the Senate Health, Education, and Labor Pensions Committee. You may recall Mr. Lindenberger is a teenager who got vaccinated despite his parents' objections. Let's listen.
This may seem true in all instances. This is not true for the vaccine debate, and I approached my mother with this concern that she was incorrect. I approached my mother numerous times trying to explain that vaccines are safe and that my family should be vaccinated. Approaching even with articles from the CDC, explicitly claiming that ideas that vaccines cause autism and extremely dangerous consequences were incorrect. In one such instance where I approached my mother with information from the CDC that claimed vaccines do not cause autism, she responded with, "That's what they want you to think." Skepticism and worry were taking the forefront in terms of information. Now, conversations like these reaffirm that evidence in defense of vaccines was, at least on an anecdotal level, much greater than the deeply rooted misinformation my mother interacted with. And that's what I want to focus on today. To combat preventable disease outbreaks, information is, in my mind, the forefront of this matter. My mother would turn to anti-vaccine groups online and on social media looking for her evidence in defense rather than health officials and through credible sources. This may seem to be in malice because of the dangers that not vaccinating imposes, but this is not the case. My mother came in the sense of loving her children and being concerned. This misinformation spreads, and that's not necessarily justifiable, but I carry this knowledge with me that it was with respect and love that I disagreed with my mother. And with the information she provided, I continued to try and explain that it was misinformed. Ideas that, again, vaccines cause autism, brain damage, and also that the measles outbreak is of no concern to the society and to America were ideas that were pushed by these sources that she would go to. And for certain individuals and organizations that spread this misinformation, they instill fear into the public for their own gain selfishly, and do so knowing that their information is incorrect. For my mother, her love, affection, and care as a parent was used to push an agenda to create a false distress. And these sources which spread misinformation should be the primary concern of the American people. Although change is already placed, more strides can be done. Almost 80% of people, according to the Pew Research Center, turn to the internet for health-related questions. I further explain some more statistics and evidence in my written testimony. Now, in terms of what I would like to walk away with today and kind of finalize with, although my mother would turn to very illegitimate sources and sources that did not have peer-reviewed evidence or information, I quickly saw that the evidence and claims for myself were not accurate. And because of that, and because of my healthcare professionals I was able to speak with and the information provided to me, I was able to make a clear, concise, and scientific decision. Approaching this issue with the concern of education and addressing misinformation properly can cause change, as it did for me. Now, although the debate around vaccines is not necessarily centered on information and concerns for health and safety, this is why education is important, and also misinformation is so dangerous. Thank you.
Thank you, Mr. Lindenberger, and thank you for coming from Ohio to let us hear what you have to say.
All right, you just heard there from Ethan Lindenberger testifying on Capitol here. You see Senator Lamar Alexander there addressing the committee. Mr. Lindenberger, as you just heard him say, was an interesting case study in folks who believe that vaccinations can hurt their children. He had done some of his own research, read a couple of books, read a couple of news articles and medical articles, and came to the realization that vaccination would benefit him against his mother's wishes, and he got vaccinated.
Yeah, he did, and so he's been sort of an outspoken critic of the sort of anti-vaxxer movement, including his own mom.
His own mom,
yeah.
Right. But what was good is she, in the reporting that we did here at CBS News, said that, you know, she disagrees with him, but she wanted him to be able to make decisions, and that she was proud of him for researching it and coming to his own conclusions as an adult. So that was good.